So good evening, everybody. I believe we're now live. I'm sure Anne will correct me if I'm wrong. Welcome to the Health and Adult Social Services Scrutiny panel for this evening. I was about to welcome you to Ealing Town Hall. Clearly we're not there and nobody is at the moment, but we're trying these virtual meetings once again. I hope everybody is well and managing in these very difficult times. We have a fairly substantive agenda, but it's light in terms of paper because both of our representatives understandably asked this evening if they could present information to you on the evening so they could give you the most up-to-date information. So they'll be informative, not off-the-cuff presentations, that's the wrong phraseology from me, but they'll be informative up-to-the-minute presentations, and of course we'll take questions in the normal way. Right. I need to ask if there are any apologies for absence. I haven't been informed of any. Anna, do you have any for me?
No, Councillor Crawford.
Okay, lovely. So we're expecting everybody, which is great. I don't have any urgent matters that need to be considered at this meeting. I do need to ask if there are any declarations of interest from councillors. I'll start with Anna Whitty.
Sorry, I'm not a councillor, but
yeah, no, go ahead.
I work for Ealing Community Transport, and ECT are involved with the vaccination programme.
And doing excellent work, if I may say so. Yes, Councillor Burke.
I'm a non-executive director at Hillingdon Hospital.
Thank you, Councillor Burke. Are there any others? No? Okay, that's lovely. I'm not aware of any matters to be considered in private. So we can move on to the minutes. Sorry, my cup of tea just turned up. Minutes of the last meeting, which are on the yellow pages of your agenda, if you have yellow pages, or they were circulated in advance. I hesitate to say this, but I don't think they're particularly controversial. Can I ask if anybody's got any corrections, comments or queries about the minutes? I'm taking the complete silence as your approval of those minutes. Can I ask that they are approved as a true and correct record of the last meeting? Thank you very much. Yes, marvellous. Okay, I'm not sure how I signed these in these digital times, but I'm sure we'll work that out. Right, our first item is an update on behalf of the Ealing CCG. As I said, a written update for you this evening. It's going to be a verbal presentation from Nehal, I think. Nehal, are you ready?
I am, thank you. Do you mind if I share my screen?
No, not at all. That would be marvellous.
Okay, thank you. Just one moment.
You might need to enable. Oh no, marvellous. There we go.
Okay, so I'm hoping you can see my screen. My internet has been a bit patchy today, so I hope it doesn't break out halfway through. So, but this is an update I'm going to give you on the vaccination plan, because I'm sure that's hot on everybody's agenda and everybody wants to know how we're doing. So this is an overview of where we've got to so far. So as you will know, we started vaccinating around mid of December, and we received our first vaccine at Ealing Town Hall on the 18th of December. We are focusing on the top 4 JCVI cohorts at the moment, which are all residents in care home for older adults and their carers, everyone over 80 years old and frontline health and social care staff was cohort 2, and then over 75, age 75 and over, and then age 70 and over, and clinically extremely vulnerable individuals. And although we're trying to achieve 100% for offering, the offer will be to 100% of patients in those cohorts and below when we get to the time. We are doing our level best to try and get to at least 75%, which would be a really good achievement based on existing programs like the flu program and other programs that we have. So we are doing our utmost, and I've got an update on where we've got to just up to 2 days ago, and where we've got to with our figures. We're trying to get these top 4 cohorts vaccinated by the 15th of February, as you all would know, about middle of February, and we are working extremely hard. Our GPs have been working extremely hard along with all of our partners, and a special thank you to Ealing Community Transport, who have been providing transport to some of these really vulnerable patients who haven't been out for quite some time, to a vaccination centre in a safe way so that they can get their vaccine. We've been focusing on dose 1, as you can imagine, and as you know, that the guidance is very clear on that, and second doses will be administered towards the end of the recommended 12 weeks. So we're just working through the plans about how and when we're going to offer and invite people in for their second dose. And the vaccine is being delivered through a number of different modalities, so in different ways. So primary care network sites, and I'll explain that in a minute, mass vaccination centres. We have roving vaccination teams who go out to housebound and care homes. Apologies. Community pharmacy sites, and I've got an update on that, and hospital hubs who are focusing on staff. There are 21 primary care vaccination sites across Northwest London. So these are run by GP practices and is where most of the vaccination is happening around Northwest London. And we have 2 in Ealing, one at Ealing Town Hall, and I'll go into the detail now, one at Ealing Town Hall and one at the Dominion Centre in Southall. We also have been going into care homes and nursing homes and residential homes with our roving teams, and also GP practices have provided some staff along with ECP, Ealing Community Partners, run by West London. Everyone is working in partnership to deliver this programme. As you can imagine, this is extremely challenging, a big logistical program, but also, you know, needs everybody, all hands on deck, and it doesn't matter who we are, from volunteers to admin people to site managers to our estates teams, IT teams, clinicians, and the CCG staff have all been redeployed to support these programs as well. We've also had housebound vaccinations happening, where our GP practices have primarily gone out to vaccinate these patients. And we have a mass vaccination site that is now opened in CP House, which is on Uxbridge Road, just opposite the fire station, not too far from Ealing Town Hall, clinically being led by West London NHS Trust. We also have 3 pharmacy sites that have gone live. One is Temple Pharmacy in Pitshanger Lane, Remedy Pharmacy operating out of St Mary's Church, and Mattock Lane Pharmacy. And there will be some more coming up very shortly, especially in the north of the borough, north of the A40, where we don't have any particular sites. So our 2 primary care sites, just to give you a feel for the numbers of vaccinations they have delivered. Ealing Town Hall up until the 8th of February had delivered 22,000 vaccines since the 18th of December, and the Dominion Centre went live on the 7th of January and has delivered 16,700. These are incredible numbers, and you can imagine the workforce involved in trying to invite all of the patients and deliver the whole programme. So just at our primary care sites, we've delivered 38,000, and that has gone up because we have been running 7 days a week. So yesterday and today we have been vaccinating at each of those sites. To give you a feel for the populations vaccinated, so we are doing really well on the 80 plus. We would like to get over 80% at least, but obviously there are patients that have had COVID or have refused the vaccine, or in some cases we found out that they are abroad and just can't get back into the country, so we can't have the vaccine. And we're doing our level best, and some people are just not ready to have their vaccine, although we're doing a lot of work. We're trying to remove any or reduce vaccine hesitancy and encourage people to take up the offer of their vaccination. We've got 77.5% of our 80 plus, 82.6% of our 75 to 79, which is fantastic. 70 to 74, 80.7. Our clinically extremely vulnerable, which is the cohort we're really prioritizing at the moment, is only at 55.3%. Now these patients are all age clinically extremely vulnerable, 18 plus. So not sure why the take up isn't as high, but we are working and trying to reach out to these patients as well in various ways. We've done 74.6% of our housebound patients, that's 18 plus who are housebound and their carers, and 84.1% of care homes residents, so that's nursing and residential care homes. So overall, we've done 72% of those top 4 priority cohorts. And from the care home staff, we haven't done as many as we would have really liked to, but there has again been some vaccine hesitancy, and we've managed to do 47%, but there's a lot of work happening to try and encourage staff to take up the vaccination. Part of the cohort is also getting social care workers, so anyone other than the care home staff, so all of the other population groups, and we believe about 2,000 have been vaccinating, just waiting for some final figures to come through, but these are primarily at our mass vaccination sites. And the first one, as you know, was opened in Wembley at Network House, and our patients and staff can access Wembley, as well as the new site which just opened on the 2nd of February, just last week, at CP House now. So they are now able to access those appointments as well. Sorry, I should just say that our pharmacy sites, they are also bookable via the national booking portal as well, just like the mass vaccination sites. So, and again, everyone is focusing on these top 4 priority cohorts at this point. We have 2 vaccines available, and it really depends on which vaccine arrives on site. But Pfizer is the vaccine that we have to use when it arrives on site. Usually we have about 3.5 days within which we have to use the vaccine up before it becomes unviable to use. But the AstraZeneca is more mobile and can be used by the roving teams and has a longer short life, although we try and use it as fast as possible. We have received a lot of Pfizer vaccine, so we have been prioritizing as soon as that comes in. That's the first vaccine that we offer, and we have done everything we can to make sure that we're not wasting any vaccine. And I'm pleased to say that so far in Ealing, we have not wasted a single dose of vaccine. I've just listed out some key successes, risks and support that we are asking communities of. So we have done a lot of work over the last week with different community groups on vaccine hesitancy. Dr. Onkasahotoza, also a local GP, did a piece and in Punjabi and English around myth busting. There was a session with the Southall councillors last week that Dr. Mahini Palmer joined as well. There was a BBC news piece around the Dominion site, what it's like to run a vaccine centre. So really encouraging take up at various sites, but I'm really proud to see the Dominion site on in that piece. And we're doing a lot of work to meet with councillors. I think there was a meeting on Monday as well with some of our staff and a couple of our local GPs who attended as well. As I said, we've redeployed all of our staff to work on vaccination programs or COVID response at this time. And everyone has been just pulling up their sleeves and getting involved and doing whatever is needed, including site operations lead for each of those sites. We've had a first meeting with our 3 pharmacy sites as well, and we're going to continue to meet with them and create a bit of a forum for all of the providers to get together of vaccines. We have run 3 what we call satellite clinics in the north of the borough. As we know, we don't have a site there, where 3 of our GP practices took some vaccine and did some vaccination close to where patients live that were just not able to come to the 2 sites. And we've had one in Southall as well. And the anecdotal feedback this week has been that the videos that have been circulating around the vaccine have had a positive impact, and patients are taking up the vaccine when they previously haven't, which is fantastic news. Obviously, there's always a risk. We're getting to the difficult part of the cohort of trying to get patients in and reach those patients that are just not sure whether they want the vaccine, and that hesitancy and trying to get some of these patients in to have their vaccine. And the Dominion site in particular has been struggling the last 2 weeks with trying to get patients in, but we have had extra staff deployed to call patients over the weekends, evenings, and I know that it's frustrating for some patients that we're calling them 2 or 3 times, but we need to make sure that everybody's had the opportunity and had time to think, and then are getting that offer again to pick up, to get their vaccine. But we are on track to meet our 15th deadline. As you can see, we're doing a lot of work around that. Obviously, the whole messaging around the South African variant in Ealing in particular, and the AZ vaccine, has added additional complexity with patients insisting on a specific vaccine. But we do encourage patients to take the vaccine that is available on that day in that centre. We have, in terms of requested support, we've been reaching out to different faith leaders, to counsellors, to community teams, to community groups, and to our staff as well, and volunteers, just to get that message out there about the vaccine, and to come and have the vaccine, and it's safe, and come to either of our sites. They can book in, and if they miss their opportunity, it's not too late. They can contact their GP practice or go on the national booking service if they are above in one of those top 4 priority cohorts to get their vaccine. Obviously, the South African variant has caused a little bit of anxiety, but we're now getting through that and really starting to get these messages through, and we have had good uptake, because we don't want to waste any of this vaccine, and we're ready to move to the next 2 cohorts as and when we're told. Just to give you a bit of feel, we have a database where we are able to look at the percentage take up of versus ethnicity, and I have some for deprivation as well. And you can tell certain population groups are slightly more hesitant or just not taking up the offer. And we're doing some work with various groups to try and reach into those communities and show and get some community leaders to really encourage people to take up the vaccination. And this last slide is around the deprivation, 1 being the most deprived area and 10 being the least. And again, the percentage uptake against that deprivation index. So I'm going to stop sharing my screen, and I hope that was a helpful summary of where we've got to with the vaccination program so far. And just to add to that, as you can imagine, because of all of our staff have been redeployed to this, but also over the last quite a few weeks, we've been dealing with the COVID, the wave 3, and all of our hospital teams and everyone in the NHS have been focusing on COVID response and delivery, and making sure we're doing whatever we can to manage services. So that's why I thought best to bring together a COVID vaccination update in particular at this point.
Thank you, Neha. I just wondered if Chris Hilton wanted to add anything. I don't know that he does. I might be surprising him here. Chris, is there anything you'd like to add?
Dan, I would really just to echo and compliment the huge amount of work that Neha and her teams of staff have been doing. The one statistic that I might add is obviously it's a significant priority for us in Ealing Community Partners and in West London Trust to get vaccine uptake by our workforce, caring for the local population. And currently we are in the early 60% of staff who've received their vaccination. And we've got a series of events to increase uptake across our organisation as well. And it's been a real partnership work, particularly for the care homes where Ealing Community Partners works with the Argyll Surgery and our multidisciplinary teams working with Neha and her team to make sure that we're systematically working our way through. And Neha and the surgery and myself have been in correspondence this week to start planning the next phase, which for some of our homes will be their second doses as and when the appropriate interval period is passed. I think that's probably all I should add.
Thank you, Chris. Kerry Stevens, you wanted to add something. Kerry.
Thank you, Chair. Just to really say that I think the NHS partners in Ealing have done an absolutely outstanding job in terms of vaccine rollout, and the engagement with the council has been very, very strong. When I speak to partners across Northwest London and tell them about the outstanding work that's been done in Ealing, but also the communication with the council, both with officers and with members, colleagues are very jealous of the outstanding work, that the communication and the engagement with the council. So just really to thank Neha and Chris and all their teams for the fantastic work they've been doing 7 days a week pretty much since the vaccine's been on the ground in Ealing.
Thank you, Kerry. I know that the feedback I've had from my own constituents who've already had the vaccine is about how brilliantly organised and very safe they feel at both of the sites, the Town Hall, the Ealing Town Hall and the Dominion Centre, where a lot of Acton residents were sent to early on. They're very pleased with everything, and many of them have written to me. I've forwarded some of those messages, so some of them should get to you eventually. Right. I would like to ask people for questions, and I'm going to start with the other Councillor Crawford, otherwise I'm going to get in trouble. But I have you, Linda, on my list next, if that's okay. Councillor Crawford.
Yeah, the chair usually makes sure there's no favouritism, so I'm always last, and most people have already asked my questions. So right, I've had great reports.
We can't hear you, Kate.
You what?
I can't hear you.
I've had great reports on progress. As an Acton councillor, I would just like to ask a few questions, because there is quite a distance, and some East Acton, for example, is quite isolated, and that's north of the Western Avenue. And to access the town hall, there's it could be for people using public transport. It could be at least two buses, or a bus and a train, if they're unable to do a lot of walking. One of my constituents called me and said that they're very anxious. They were going to take up the offer, but the invitation was for something like 9 o'clock and 5 o'clock, and both to get there and to come back would have been in rush hour. They did it, but they were feeling very, very uncomfortable. And there was not enough for them to report back and to say, other than just to refuse it, to actually say, hey, this is I'm going to have to use public transport. I can see that there's some satellite sites. So I hope that one is being considered for East Acton, north of Western Avenue. and that we can actually look at setting up a centre in Acton. I appreciate there may not be some really large buildings, but we do have the town hall, Acton Town Hall, and the new leisure centre. That it would be ideal to create a satellite centre. And no.
Kate, we can't hear you when you turn your head. Yeah.
Thank you. Nehal?
Yes, shall I try and answer that? Sorry, I didn't capture all of it, but I think the question was in effect that East Acton can be quite isolated, and the feedback that patients haven't had the choice of appointment times when they've been offered the vaccine and then had to use public transport, which made them quite anxious. I think that was the summary of the questions, and whether a new site could be set up in that area. So we aren't setting up new sites. So just to explain what the satellite site clinic would be, it would be, so we may have a cohort of patients who just can't travel to one of those sites, and in one of our community centres for a day, and literally the vaccine has to be taken off-site, and it's only the AstraZeneca has to be taken off-site in a cool bag and delivered within 6 hours of it leaving the premises. That's what we try and do, and we have a full assurance process that needs to happen. So we need to have a cohort of patients that are going to be vaccinated in that small period of time in an agreed setting, and usually we've used the GP practices, but we are looking at other sites that we could potentially use, and we need the workforce to be able to go and do that as well. So it needs to be planned. So we're not, just to be clear, we're not setting up additional new sites in any part of the borough, but these will be opportunities to expand the way patients can access these appointments, but it won't be the primary way in which people can access the vaccine, and will be specifically for these hard to reach groups. Hope that answers the question.
There was just another point about the timings of the appointments that were given. So I've had some feedback as well about people getting either a very early morning appointment or a very late evening appointment, and then being concerned about travelling in the rush hour.
So the way the appointment system works, they are open all day, every day. And if a patient has gone in there and booked their appointment at a time that is more convenient and they're the only 2 slots left, unfortunately there's limited what we can do about that, but we are running daily. So if a patient is coming via public transport and that is a real issue, then they may want to wait until the next day. But we do need to try and get this vaccine out to people and in people's arms as soon as possible. So I would encourage people to take up the appointment slots that are available.
Thank you. I'm going to move on now. Councillor Burr.
So I've got quite a lot of questions, so bear with me, I'll go as fast as I can. So first of all, I am quite worried about that, Nia, in terms of the north of the borough, you've said already, isn't well served. When I look at your population chart, I'm worried that we're going to start making this into a self-fulfilling prophecy in terms of the groups, deprivation, etc., etc., etc. When I look at how many in my ward, I've got Pitshanger, I've got the Town Hall, I've got CP House, that are really easily accessible to a bunch of middle-class people in my ward. So it really worries me that that's where our focus is, when actually the people that most need it and suffer most and die most are getting the least access, except for the Dominion Centre. So and sorry, Kerry, I should start by saying really well done. This is all in the context of really well done. But I actually don't think the communication with councillors is very good. I was trying last week to find out about the north part of the borough. And what I think we need, if this could be an action, Dan, if that's possible, is I'd like to know if I'm worried about a particular person, and they're saying to me, I'm 75, I can't get 2 buses, I can only go at 9 o'clock, how to get an appointment on a day at a better time. How do I do that as a counsellor? How do I help them? How do I help them navigate the system? Because it's not obvious. I'm a nurse, and and I tried to do it yesterday and I couldn't do it. I'd like that information that I could help all my residents with. Secondly, if this whole thing about the north of the borough, I've been banging on about it for 3 weeks now and nothing has happened. Whose decision is it? It's great to meet you now, but if I wasn't on this committee, I'd still been on the wider, and I've been writing to lots of people. So I think we need a charter. If you've got a query for a resident, if you've got a query about a site, if you want to actually influence where we have sites, it would be really helpful to have that information. Because at the moment, I don't know where to go. I've literally, and I really don't know how to help residents. I'd be with Kate. If somebody, little old lady comes to me and says, where do I go? I just don't know what to do. And if I, as a senior nurse working in a trust, don't know, as I say, it could become a self-fulfilling prophecy.
Tell you what, Councillor Burke, shall I get Neha? I'll come back to you with the next set, but there's quite a bit there. If I get Neha and Chris and Kerry, if necessary, to reply, and then we'll come back to you for the rest of your points, yeah? Neha.
So starting with the North issue, we have been working with the national team to find pharmacy sites that could go live in the north of the borough. So that is the point. And trust me, myself and Dr. Mahini Palmer and working with our local authority colleagues have really been on this one since the beginning. We were looking for a venue close by to run 3 sites across Ealing, but the workforce is the issue. It's really difficult with the amount of staff that you need to man these sites and to run 7 days a week. It takes it out of people, as well as the GPs working full-time as well, and the surgeries aren't closed, so they are doing this on top of. So finding that workforce to run a third site in full is quite challenging, and that's why we made a decision when the estates that we were looking at fell through actually in the north. We chose not to actively pursue that until we knew that we had the 2 sites running. But what we have then done is we've pushed for the satellite clinics to then be stand-up clinics in the north of the borough. We've talked to local pharmacies in north of the borough to try and get some of those set up as well. And I'm hoping they will go live very shortly north of the A40. So please just look out for that. So that will be one way of supporting your local person that might not have had their vaccine. In terms of if you are worried about a particular person, the first port of call would be they need to talk to their GP practice, because their GP practices are booking them into the slots, and they are booking them into slots. If that they don't want to do that, they can also go via the national booking system to book into one of the mass vaccination sites or the pharmacy sites as well. So that would be the other option. And they should have, if they're in that cohort, they may have received a letter already with the details of the national booking system, but that is available. And I can't remember, it was how do you help? I think they were the 2 questions. Have I missed
information for councillors?
So if, something like that, as a Q&A, FAQ sheet for us as councillors, that one, how to help a resident. But the second one was about the team at the CCG. I don't want to be emailing everybody at the CCG randomly. Who's our go-to person at the CCG? Again, a note saying who that is, if you've got queries, if you've got concerns. That something like that would be really helpful for us as councillors to have. How you help a resident, if you've got concerns about the sites, etc. Otherwise, we're all emailing 10 of you, and you've all got 10 emails to answer that you haven't got time, or better things to do.
So as Kerry said, I think we do have very regular meetings with our local authority colleagues, but I would, because all of our CCG staff primarily have been redeployed to the vaccination centres, I don't think you'd get very much from emailing CCG staff. I would contact our comms team if you're not getting a response, but Kerry and a lot of the team can get those queries through to us as well. And we do actually have frequently asked questions, and I'll make sure that gets circulated to you.
So Kerry's our go-to person.
Well, Kerry can make sure, Kerry and Judith, Anna, they all can get, they know where to get the answers and who to contact.
Sorry, I'm banging on about this and I will just stop now after this. But already in your answer, can you see that it's muddled? Kerry, Judith, there's a whole load of names thrown there. Who are they? What are they? As counsellors, one name about that person, if you email, they will make sure you'll get a response, would be absolutely brilliant.
I wish it was that simple. I just don't have somebody sitting and just answering queries at the moment because we're all redeployed. Kerry, I don't know if you have any thoughts or suggestions?
So I'd suggest that if councillors have specific queries about vaccine sites, that they come direct to me in the first instance, and I'll raise them with NHS colleagues separately. But just to reiterate Neha's point with regard to if it's about individual local residents, that people should speak to their GP in the first instance. But if Councillor Burke, if there's specific concerns you have about access to vaccine sites, if you raise them directly with me, and I'll make sure that I filter them through to discussions with colleagues at the CCG.
Sorry, Councillor Rye, you wanted to come in here, I think. Sorry, I didn't see your message until now.
That's fine. I think both Neha and Kerry have covered what I was going to say, but the only other additional point of information for Councillor Burke is that I have been talking to the comms team, and I am hoping within the next few days, Linda, that information will be much clearer. So I did pick that up. So just to reassure you.
Thank you, Councillor Rye. Councillor Burke, you said you had some more questions.
And if somebody else wants to come in first, though, because they're quite specific things, because I'm aware I'm taking up a lot of the time.
Yeah, go for it now.
Okay, so just a quick question about, actually, I do know a lot of people under 70 that are having them, are being invited in. Is it because without, it seems to be, again, very concentrated in the centre of the borough. So I'm worried, it's great they're being invited in, but I'm worried they're being invited in whilst others aren't. Domiciliary care, what are we doing about that? And on the great that every bit of vaccine is being used at the town hall, are we making sure the same's happening with the Dominion Centre?
So yes, absolutely. We're making sure that no vaccine is going to waste at either site. And that is partly why some patients below the 70, those top 4 cohorts are being invited in, because if we haven't been able to get some of those from the top 4 cohort, we are offering it to make sure that the high risk people in those cohorts are getting the vaccine. We just really don't want to waste any of the vaccine, as you can imagine. And that is the same principle at both sites.
And the domiciliary carers, they weren't on your list.
Kerry, I don't know if you wanted to answer this one.
Thank you. We're very conscious, Councillor, about the domiciliary care workers are absolutely key workforce in any borough in terms of supporting vulnerable individuals. There's an active programme of promoting access to the vaccine. The domiciliary care workforce has been part of the first wave of the vaccine programme. We're very conscious that they're a harder group to reach than residential care workers because they're not all based on one site. The numbers that Neha shared earlier on the social care workforce will include domiciliary care workers. Ealing, I think we've got the 3rd highest number of domiciliary care workers in London registered to Ealing. So there's a significant programme to ensure we offer the vaccine to everybody and encourage and provide information and advice on to them all in terms of dealing with vaccine hesitancy. But it's a clear programme of work. We're very conscious of that cohort, Councillor Burke.
Okay, thank you very much. I'm going to go to Councillor Raza now. Councillor Raza.
A bit like Councillor Burke, I've got a few things on my list, so let's hope I can run through them quite fast. I've strongly agree with Councillor Burke about what she was saying about not being, and also Kate Crawford about why were these sites chosen to be so close together, and how were they chosen? Because in Greenford, where my residents are, we have the Greenford Town Hall, and we've also got an offer from the Boots in the Westway, which is quite a big place, which has lots of possibilities for people to sort of drive there and get there quite easily. That thing about being a black hole, I'm seriously concerned about the community there, which is very diverse and actually quite a large cohort of vulnerable groups there too. So yeah, just reiterating that particularly for Greenford and Northolt, there's a bit of a black hole, and that I'm just intrigued as to why that was left as a black hole when there were places that were offering their services to be a centre. Secondly, also this the ECT have been doing a fantastic job. Can't praise them enough, but they weren't really patients weren't really told about it. A lot of people were calling me about buses and public transport. They didn't seem to realise that ECT was there. So I'm wondering how that sort of comms could be better. It has been better recently because I know that some people have come back to me and said that they were told about it. So whatever was the glitch there is getting better, but it could be improved. The other thing also was the confusing NHS letters. I'm getting a lot of calls from residents about lots of NHS letters coming through about booking appointments, when some of them have actually been for their first jab already. So they seem to think that this is the second jab, and so they merrily go on there to try and book themselves back on, but actually it's the first one again. So there's a lot of confusion around what the letter is about, and it doesn't sort of specify very clearly that it's about the first dose, and if you've had it, to ignore it, because quite a lot of elderly patients have actually come back and said, well, you know, I'm getting my second one actually because I got a letter through, and they ring for clarification. And finally, how are we sort of in touch with Brent and with Harrow and our neighbours, who we also have people who are residents of Ealing but actually receiving things like rehab care or some sort of care in a care facility across the border? Because I have a particular resident who I actually have contacted the CCG about, who is stuck in a rehab centre in Brent, and therefore we're having absolute mountains moved, or whatever's happening is happening at some bizarre magical way, because we're not really kept in what's going on. She needs a vaccination. She's an Ealing resident. She's there clearly in a rehab centre. So what's the problem? Why can't we get her vaccinated? There seems to be some sort of issue around not managing people who might be Ealing residents but elsewhere in West London. So what are the sort of connections that you have there, and why is there this sort of glitch? Because I assumed that being the same sort of area, we might actually have a smoother way of talking to each other. It does seem quite silo-y. And I think that was probably all of it. Just to finish on something positive, my mum had hers at Ealing Town Hall, was wonderful. Can't praise the volunteers, the actual medics. Everybody was absolutely brilliant, in and out, really, really slick operation. So congratulations on doing that. I realise that this is a complete mammoth of a job, and I can't praise the NHS enough for actually getting it all together in such a wonderful way. But it would be really, really helpful if you'd kind of plug our gaps for us, or have, like Councillor Burke was pointing out, a point of contact, because as residents call us and we don't know what to tell them, it would be really helpful if there was, say, a one person to go to, or maybe even a question answer sheet that we could refer to. That would be really helpful. Thank you.
Councillor Raza. Neha, would you like?
Sure. So I
to
think
have a go?
a few questions here. The first one about why are the sites so close together? I wish I had a better answer, and that I was in control of choosing the sites, and unfortunately I wasn't. we were responsible for choosing the primary care site, so which was Ealing Town Hall and Dominion Centre. We wanted one in the north, as I was saying before, but the estates that we wanted to use fell through, unfortunately. And actually that was going to be a mass vaccination site. And that's when the team that were working on the mass vaccination program, which wasn't at the CCG level, but more at a regional level, chose CP House because that's the estates that was suitable to use for the mass vaccination purposes. Unfortunately, that did leave a gap in the north of the borough. The pharmacy sites also were not of our choosing. The way the pharmacy sites program works is that pharmacies had to put themselves forward, say, yes, I want to deliver the vaccination program or not. And if we just don't have vaccination sites that put themselves forward at that early stages, they didn't go through. However, we've been working with NHS England and trying to get, and Boots in Westway, to be honest, to try and get them assured and to be able to vaccinate. So I would say, again, just watch this space. I think it'll be very shortly that we are hoping for Boots in Westway to go live in the next few days. We should have some communication, so that will be a fantastic addition. And there is another site in Greenford which we have been advised that should be going live shortly as well. So hopefully that's 2 pharmacy sites in the north of the borough in particular. Ealing the community transport service. Apologies if the communication wasn't clear. As you can imagine, we've been running at breakneck speed, so the communication may not have got through to all of the patients early on as we would have liked to, but we have reiterated the messages through to the GPs to make sure that they are communicating with the patients and that they know that they can access this service if they fall within the criteria of using the Ealing community transport. And I know they've been doing amazing numbers and transporting a lot of patients. And hats off to all of the GPs in Ealing. They have been working incredibly hard, 7 days a week, and all staff, just to keep these sites running and do the vaccinations to the date, and making sure that we're not wasting any doses, etc. So really, a big thank you to all of the GPs involved in this programme. I also recognise the question, that the comment that you made about the confusing letters, actually, for the national booking in particular, that then came out afterwards to say you can book your appointment. It was more straightforward when the mass vaccination sites weren't live. However, we do need them and they are on a different booking system. We did feedback about the letter to try and make it as clear as possible, to say that if they had an appointment, or if they have an appointment with their GP practice, to not worry about this one and not book an appointment. But I will try and get a hold of that letter and keep feeding that back nationally. So that's, I will make sure I pick that one up as feedback. Feedback in letter. I've made so many notes, I can't remember half of it. The link back with Brent and Harrow and our neighbours. Definitely, if a patient is in a setting of care that they should be receiving the vaccination, they absolutely should be receiving the vaccination. And whether that is one of our Ealing teams that delivers that vaccine, or a Brent team that delivers our vaccine, and we're working really closely with all of our partners, meet with all of our NHS colleagues daily at the moment across the whole of Northwest London. And if there is a specific setting of care that you think isn't being reached at the moment, that have patients in there with these top 4 JCVI cohorts, please do let us know, and I will pick that up and see what we can do to get that patient vaccinated. There is no reason that they shouldn't be vaccinated if they're within that cohort.
Okay, thank you, Neha. Councillor Raza, if you want to send an email with some specific details about that particular patient that you were talking about, that might be the best way forward.
Well, weirdly,
Yeah.
I did to Mahini Palmer, and
Right.
it was apparently being chased up. But I got a call from her daughter, the lady who should be vaccinated in this rehab centre, and we haven't heard anything. She hasn't, and I haven't, and we're all kind of a little bit at sea as to why not. So yeah, I have written a reminder to them too, but it seems to be there's a little bit of a hiccup as to who's talking to who and how, but I guess that's to be expected.
Councillor Crawford, may I?
Yes, of
offer
course. I was about to come to you, Chris. Yes, go ahead.
I put my hand up really just to see if I might assist on the rehab setting question for Councillor Raza, because I don't know the circumstances of this case, and obviously not appropriate to discuss them in this meeting. But in terms of physical rehabilitation, what we are usually trying to ensure is that Ealing residents are admitted to the Ealing facilities that Ealing Community Partners delivers at Clay Pond Hospital, or are receiving community rehabilitation in their own homes. Unfortunately, during the COVID period, we have had to be more flexible than that across the Northwest London system in order to make sure that we weren't mixing together different cohorts of patients. So patients who were COVID positive, patients who were COVID recovered, patients who may have been COVID contacts whilst in hospital, so that they weren't putting other COVID groups at risk. I can assure you that as the clinical director in Ealing Community Partners, I've been doing my very best to keep as many Ealing patients in Ealing as possible. But also, as Neha said, we've been working on a daily basis. We have meetings twice a day with the community providers in Brent and across all the borders in Northwest London, 7 days a week, to actually discuss the repatriation of patients back to their local area when it's safe to do so back at home. I might add, in terms of if it's a short stay admission to hospital, and at the moment most of the rehabilitation facilities for inpatients are working towards trying to keep the length of stay relatively short. So we normally have inpatient rehabilitation for normally kind of 2 to 3 weeks, followed by community rehabilitation, in order to make sure that patients are not sitting in community hospitals for longer than is necessary, partly in order to make sure that we're keeping the hospital flow moving. What we are generally doing is making sure that patients are plugged into their vaccination program after discharge. And there's a really important reason for that. One is, just as Neha described, trying to minimize the wastage of vaccine. And actually it's whilst you might think giving the vaccine in a healthcare setting should be quite easy, which of course in terms of the staffing it is, what we don't want to do is open a vial to give the vaccine to one patient and then find ourselves having to waste the other 9 doses. So it's so that's one reason. But the second reason is actually to make sure that they are able to receive the second dose from the same organisation. And actually, we don't wish to be recalling patients back to an inpatient setting to have a second dose when we can get them the first dose and the second dose from the same provider, because logistically this becomes incredibly complicated. So generally speaking, for people in short stay settings, even those in the highest JCVI cohorts, the recommendation is that they are receiving the vaccination on discharge. And we are encouraging and supporting patients when we discharge them to do that. I hope that might offer some explanation.
Okay, thank you, Chris. I have Councillor Steed next.
Hi, Danny. Hi. Can you hear me?
Yes, I can hear you fine.
Okay, great. First of all, can I just echo the comments already made by fellow councillors? Anecdotal feedback I've heard about people visiting Ealing Town Hall is being very, very positive indeed. So again, thanks to everyone involved in that process. My question is just picking up on the statistics we've had about the vaccination rates in the various cohorts, which all look pretty positive. To me, the one that looks a bit surprising is the 47% figure for care home staff. I think was it last week or the week before, the number of deaths in care homes was the 4th highest since the pandemic began. So I think that 47% figure is of some concern. And I'm wondering, can Nihal comment on that as to why that might be? Is it to do with the ethnicity of the staff who work in the care homes? Is there a correlation there, maybe? Yeah, I think that's about it, actually, Dan. Thanks.
Sorry, I was on mute. Go on, Nehar. Yeah, is it Nehar or Kerry on this one?
Well, that's exactly what I was going to say. It actually might be Kerry and Chris that might be able to give a better answer to this one.
Sure. Okay, Kerry, you go first.
Thank you, Neha. Thank you, Chair. It's an absolutely key point, Councillor Steed. The vaccination of staff working in the care sector, whether it's domiciliary care or care homes, has been an absolute priority for NHS and for the council. There has been some concerns about vaccine hesitancy in terms of people working in the care sector. We've been working very closely with the North West London roving groups and also with the Argyll surgery, who have been doing the vaccinations within the care homes. There's been a number of returns to care homes to ensure that care home staff are given multiple opportunities to access vaccine, and the communication and education strategies with care staff across the care sector is key. We know that the care workforce in Ealing and across London, it does have disproportionate levels of representation from certain groups and communities, and we think that this may be impacting on some of the hesitancy, but we also know that there's some challenges for people to access information through routes that other work groups would find more accessible. So there's a significant programme looking at this, Councillor Steed, but we do reflect your concern.
And Chris, did you want to, sorry, Andrew, I'll come back to you. Chris, did you want to come in?
I don't think I've got more to add other than Kerry, other than to say that the shift pattern working of a number of these workers does make it an added level of kind of operational complexity to try and ensure that we are offering an opportunity for all of these staff to be vaccinated, because obviously the night shift staff aren't there when the day shift is visited and we vaccinate the patients. So we are doing everything we possibly can to encourage those staff to take up the opportunities and going back and offering it again.
Sorry, Councillor Steed, did you want to come back?
I was just going to say, am I right in thinking that it would be fairly mandatory that those same staff, even if they're not being vaccinated, they're being tested on a very regular basis?
Kerry, yeah.
Yeah, Councillor Steed, you're absolutely correct. There's a clear programme for testing of all staff working across the care sector. That's within domiciliary care homes, domiciliary staff, care home staff, and that's now being rolled out today, centre staff. Just to reiterate another point in terms of the size of the challenge in Ealing, we've got the fifth largest number of care home beds in London in Ealing, so the number of staff and residents is significant in Ealing, and also very high numbers of home care staff. So whilst the percentages may look concerning, and I think that they are, the number of vaccines actually delivered is probably masked when you look at the percentage rather than the actual numbers.
Okay, thank you, Kerry. Mr. Cook, you've been waiting a long time, so go ahead now, please.
Thank you. Councillor Steed's taken the wind out of my sails sort of thing, asking the question, which is the point that I was going to make. But I also understood that the government were talking about care homes and people working in the NHS actually being entitled to 24/7 access to vaccination. So that was the question. The other point that I would like to raise is I actually have used the facility at the town hall, which I found extremely useful. My GP phoned me up. I had a choice of days for appointment and actual time. I went along, and the only thing that I would say that was a little bit questionable at the town hall was they'd actually weren't giving out any leaflets about the side effects. Now, I've spoken to other people, and apparently I just happened to pick a day when there wasn't anything being given out. And the actual letter that you get from the NHS, which I received a week afterwards, actually turned around. If you look right at the bottom, it does say, if you've had your vaccination, please ignore this letter. Thank you.
Right, so thank you, Alan. Does anybody want to comment on? I'm not sure that it's the 24/7 vaccination. That was the main point of the question. I'm not sure we're quite there yet in terms of offering that. That might be more of an aspiration than a reality. Nehar, Kerry, can anybody speak to that? Where are we at the moment on care home staff?
My understanding is that there isn't a 24-hour offer currently. Chair, I think Alan's point is something that was discussed a little while ago with regards to a 24-hour offer. I think it was the leader of the opposition that raised that in Parliament. I think Nehar and Chris's teams are working flat out during working hours, 7 days a week. But obviously, as soon as we find out if there's a 24-hour offer, we will share it with everybody.
Thank you very much. Anna Whitty, you wanted to come in?
Yes, please. Thank you, Chair. I've got a question. I wanted to explore a bit more about the ethnic groups that might be hesitant. Is there something that the Ealing Community Network can help with? Has there been an attempt to break down further some of the groupings, because they're quite broad? Like, for example, do we need to be doing some more work with the Somalian groups, Polish people on a white side, the white group? But is there anything we can do to help?
Chair, shall I answer? So from my perspective, we haven't been able to break that data down even further. I'm not sure whether we will be able to, but it is something we are all exploring already. There is always work we can all do to try and reach out to various communities. So I think if there are any specific communities that we think that we should be reaching out to, that anybody hears of, and if Ealing Community Network picks up any groups, I'm sure we can find some GPs or clinicians to come and have those conversations. But really, we're reliant on everybody feeding back and getting those messages through, but also identifying these groups that might need additional support that we can then try and bring the right resource to. So any help is gratefully received.
Okay, thank you. Kerry, you were waving at me.
Yeah, so thank you, Chair. Just to reiterate Nehar's point, there's a lot of work going on in this area. I know colleagues within the CCG, ECP, but also our Director of Public Health are very seriously engaging and looking at opportunities to work with different community groups in the borough and to provide access to information and support to those groups to raise awareness about the vaccine and the benefits of it.
Okay. Thank you very much. Councillor Crawford had a question about the care homes, so I think I'll take that before we move on.
Has it been considered whether vaccinations for staff of care homes could be done at the changeover of day and night staff? At that time, you know, early evening, most the day staff have done all the work to get residents, you know, in bed and bathed and in bed. So that might be, you know, that might be something to think about. And also, and at the same time, some work can be done on the hesitancy. Some extra work can be done with a doctor, the doctor talking to some staff members.
Shall I come back on that, Chair? Just to share the experience of colleagues from the Argyle Care Home Service, which is part of Ealing Community Partners. Absolutely, you're right. We did our very best to make sure either that we were using shift handover times to maximise the uptake of staff, but also inviting staff where we could plan our visits to book in and and to come in and have their vaccinations. And you're absolutely right that that was a very good opportunity for us to tackle hesitancy. I think people seeing their peers being vaccinated had an enormously beneficial effect, and also receiving the vaccination from clinicians that they recognized providing good care to their patients. So all of those things were really, really helpful in the nursing home setting. I think we're now trying a second round of replicating that for to get that percentage number up. But the work continues, and we will continue to do it as we go around the care homes, giving vaccinations to people who weren't residents at the time, who've been discharged from hospital or wherever since we went with the first round. And as we go around giving the second vaccination, staff will also, again, we will try to target staff using those approaches.
Thank you. Kerry Stevens, you want to come in?
Thank you, Chair. Just to add to Chris's points, we continue to work very closely with managers and providers in the domiciliary care sector and the care home sector. We have fortnightly meetings with all the registered managers where we develop the links between NHS partners and the provider sector. We have regular presentations around vaccine hesitancy, and also we know that there are one-to-one sessions available for staff who are hesitant to speak to a clinician about their concerns. So that there are a range of options available.
Okay, thank you, Kerry. I don't have any more indications from members of the panel at this point. I do have had advance notice of one question from a member of the public, and I did see Eve turn. Oh, excellent! You put your camera on, Eve. You're ready to go. Brilliant. Hello. Good evening. And if you'd like to ask your questions, please.
Yes. Thanks, Chair, for taking my question. Can I say that on behalf of our campaign, we do want to thank everyone in the NHS for the fantastic work that they have been doing. I've actually had my first vaccine and went to the Dominion, and I can absolutely say that it was a really excellent and efficient service. So well done to all the staff across the board for all the great work that they're being done. And I'm sure they might be quite surprised. I don't often do lots of praise, but I am doing it in this particular case. Can I also say that through, and obviously I'm from Ealing Save Our NHS, that on our social media, we are trying to do what we can to challenge some of the myths that are going on about the vaccines as best as we can. And we have used the video from Dr. Onka Sahota, which got quite a good response. My question is about a slightly different group of people and about their access to the coronavirus vaccine. And that is because we've heard from a number of different sources, including in some forums in Southall, that some people in Southall may not be presenting for the vaccine, or indeed as part of test and trace or so on, for fear of their residency status being reviewed by the Home Office or police. And this clearly increases the risk of there being another layer of people being unvaccinated, untreated, and basically outside their defences against the pandemic. And this is also reflected among those people who do have secure status, and has been really exasperated on social media posts, and in particular around people who are very concerned around the Windrush scandal. The general assurances often given by the NHS on this relate to treatment being free and unconditional, and that doesn't really seem to be, in our view, sufficient. And I should just say, as an aside, today there was a campaign. There's a letter in the Independent from 140 organisations, including the Refugee Council and other organisations concerned, like Joint Council for Welfare of Immigrants, about this being a huge problem, and obviously doesn't just affect that group, but has a huge effect on the wider population. So getting to my question is, can the council stroke then the scrutiny panel urgently ascertain from the relevant authorities, which would be the ICS, CCG and the trusts, exactly in what circumstances information is passed on to the police and the Home Office, and whether there are any barriers to a firewall being erected to alleviate these worries. So that's my first issue. And it would be good to hear from the NHS representatives present at this meeting if they've got any comments. Sorry, it's a bit of a longer question, but I think it's a very important issue to be dealt with. So that's my first.
Well, thank you, Eve. So before I ask colleagues to comment, I would offer my own personal experience of this. Very early on in the vaccine rollout, I had a phone call from a family member of somebody who was concerned for precisely this reason. And I spoke to my local police officers who relayed my query, and they told me that they would not be getting involved in anything like that, that if someone was entitled to go and get a vaccination, they should go and get the vaccination without any fear of any kind of repercussions of the type that you're describing. And as far as I'm aware, that has happened. That person has now been vaccinated. I appreciate that's an individual case rather than a general policy, and I will invite colleagues to give us an answer. Chris, are you indicating at me? Sorry, I couldn't see whether you were indicating or moving your camera.
I'm happy to make a comment, but I don't necessarily feel very qualified to do so. The reason I was moving my camera is I was looking back at the ministerial announcement that was made, I think about 48 hours ago, attempting to address this issue and to provide assurances that the immigration status should not be something that discourages people from getting their vaccination. But of course, I recognise the anxieties of the individuals that you're describing, and I don't know more than the assurances that we've all been given that I read through the media.
I mean, I'm very happy to write to somebody in a higher position, not to denigrate anybody on this call, but in a higher position, perhaps with the authority to ask to give me a definitive answer, Eve, if you would like that as an action point for me to write directly to somebody at the NHS, and even if necessary to a government minister, to make this clear.
Yeah, that would be great, Dan. I don't know if Nihal has any comment from the CCG. It might be difficult because it's not, but that would be good to hear if you have any views on it.
So I will leave that up to the Scrutiny panel to make the decision about how you want to take that up more formally. But from a CCG perspective and from a local health perspective, it is definitely one of the issues that we have also been having a conversation when we meet with our local authority colleagues as well, to make sure that these patients do access the vaccine. And it's not just about getting the vaccine, because the NHS is ready to give those vaccines. That's not the issue. It's also reaching these people when they are not on any register. How do you invite them? How do we get to them to then make sure that they have their vaccine? So it's a very live issue that we're also in discussion.
Councillor Rye would like to come in. Councillor Rye, sorry.
That's okay.
I left you a bit late there. Go on.
Yeah, I think Neha's already said what I was going to. It was one of the topics of discussion at our meeting today, that we want to make sure all these people are vaccinated and have access to the vaccination programme. And it is a piece of work that we'll be picking up for the next phase, Eve. And if it's okay with you, I may come and have a quick chat with you about it as well.
Sure. Okay. Eve, did you have another question, or am I imagining?
No, I was just going to say that, Chair, I would like you to write to the Trust. We have been trying to get the Trust to have a discussion with us for some time about passing on information. And although they say they don't ordinarily do that, so I wonder if you could include the Trust in your letter as well. That would be, I mean, Chris is obviously from the West London NHS Trust, which we haven't had that discussion with, but certainly the London North West Trust would be, the Acute Trust would be a good one as well. So if you could write to all of those, I think that would be, if you don't mind, that would be very, very, very helpful. And it's good to hear that that issue is being taken up, because clearly it is quite a worry for us and for other, and for the community as well. Thanks very much for that. My other question actually isn't really related to vaccines, so I don't know whether shall I do it later? My second question, it's not about vaccines?
Well, I'm only wary that if you do it later, so the people who you might want to answer it might not be here. So
actually, it's a question to the panel rather than to anyone who's here.
Oh, well, in that case, I will be here. So yeah, we can do it. We
Unless
can.
you're going to leave your own meeting, I don't think it'll be.
No, as much as my colleagues would like me to, I'm sure. But I'll tell you what. Let's do it now, and then if it's not the appropriate time for me to answer, we can do it at a later stage. But yeah, give me the question now so we don't lose it.
Okay, so it's really about asking if you could table a discussion on the impact of COVID-19 on services provided at Ealing Hospital and plans for recovery. We did ask about this last year in July, and given that certain services like the overnight general emergency service and trauma and orthopedics still remain suspended, and the London North West NHS Trust has said they're going to review this in March and April. We were very much hoping that you could put that as an agenda item in April, so that we could ensure that perhaps the panel is able to question the Trust and really ensure that the best interests of our local communities are being considered. So that's why I thought maybe it would be more appropriate later, but since you asked me to do it now, I am.
Yeah, that's fine. So it is on our work programme. It is something that we've been looking to schedule. Obviously, the impact of COVID diminishes the amount of time that various people in the NHS have available to answer some of these questions, but I will undertake to speak to them again about this pressing issue and make sure that we get some time for it to be discussed in this forum as soon as possible. Obviously, without speaking to them, I can't commit to having it on the very next agenda, but I will do my best for you. And I will come back to you when I know, when I've got an answer, basically, and we can talk about what the next steps are. And I may well speak to you as well about your first question and what phraseology or which trusts and which organisations we should be writing to. I'd like your input on that. Okay.
Yeah, appreciate that. Thank you.
Lovely. Well, thanks very much, Eve. I don't have any more indications for questions on this. Oh, sorry, Roy. Yes, you're waving at me now. Roy, please. Sorry, I forgot about you. It was not intentional. Go ahead if you wish.
Yes. Can you hear me? Can you hear me?
Well, I can hear you and I was on mute, but yes, we can all hear you.
Oh, good. Thank you. Yeah, I just wanted to come in here because I think our question is probably relevant at this stage. And it goes back to some of the information that Neha has given earlier. We wanted to know really how many housebound people and their carers remain to be vaccinated. Many of these people remain very isolated and anxious about being left out and forgotten. And obviously they were forgotten in the earlier stages of the pandemic on issues relating to PPE, etc. And it's not always clear for them who they should, or their relatives, who they should be contacting or to get more information about vaccine arrangements. And really, as some of the councillors have mentioned, it does need to be clearer as to who should be contacted for these people who are desperately ringing around various agencies and trying to find out what they need to do to get a vaccination. And so it's really just to add that query at this stage. Thank you.
So I'm not sure. Neha had some statistics that you're going to refer to now, Neha.
Yes, that's right. So we have actually vaccinated 75% of housebound patients that we have on our GP registers at the moment. And I know that daily there are GPs arranging to vaccinate the remaining housebound patients. So that is really positive that we've managed to do at least the 75%, and we're trying to get to 100% as quickly as possible. The housebound program started quite late, but if there are any patients that are housebound, haven't had the vaccine and are asking that question, they should contact their GP, just like all of the other patients that have any queries about their vaccination program in their GP practice, we'll be able to arrange that for them.
Thank you, Neha. Kerry, did you want to, were you waving at me, or is that my screen playing tricks?
I was waving, but Neha came in. I had the information ready to answer Roy's question, but so did Neha. So that's great. Thank you.
Excellent teamwork there. Brilliant. Okay, Roy, you've got some more questions, but I think the remainder are more suited to the social services, adult services section. Is it okay if I?
Yes, I think yeah, that's fine. Yes, thank you.
Lovely. Okay, thank you, Roy. So I just wanted to sum up this little section. Thank you, Neha, and Chris, for being here to present and answer questions. We know that time is pressing for both of you and your colleagues at this point. There is some concern and some strong feedback from members of the panel about probably some decisions that, from the way you told us it, Neha, weren't in your control originally, around the siting of the mass vaccination centres, how it's determined where the pharmacy sort of centres came into operation, and geographically where they are, and some of that information that has been communicated out to patients and the wider public around the vaccination program. So I may well write to the North West London NHS and other NHS colleagues, just communicating that feedback, as well as alongside positive feedback that I think every councillor who's spoken this evening has also given about the setup for vaccinations and how positive it has been in the immediate term. And there's also some discussion from colleagues as well about how we get information from the NHS and the CCG. And I know I take your point saying that all of your staff are deployed on this vaccination rollout. And I totally understand that. But we may need to look at how best we can facilitate councillors' feedback, considering, you know, people are phoning us every day with a query. And some of that information is not readily accessible. You know, for the moment, we'll go through yourself and Kerry, but it may be something to think about, particularly as we get now more to the individuals who are harder to reach from various different communities and who might be expressing some vaccine. How is it described? Vaccine hesitancy, I think, is the phraseology that we've been using. People who are in two minds maybe about taking the vaccine. But broadly, I think it's a significant achievement what we've been able to do so quickly, and certainly it reaffirms everybody's support and belief in the NHS, and is another sign that of the wonderful work that so many people are doing, particularly our GPs, and at all levels of the NHS, people coming together to deliver this service. I know how much my constituents appreciate it, and I know that's the case for everybody who's involved on this call. So on behalf of the panel, we'd like to thank you very much on behalf of your colleagues, and if you could pass on our best wishes and sincere thanks to everybody involved in this process so far, because I know how grateful everyone is. Thank you very much.
Thank you, Chair, and I will pass on that to all of the vast number of people that are involved in the programme.
Brilliant, and please stay safe and well, won't you? And I'm sure we'll see you soon. Thank you, Neha. Brilliant. Right, Kerry, I think we're going to move on to the social services element and the impact of COVID, and that's your domain to present now.
Thank you, Chair. I'm just going to try and share my screen because I've got updated stats for members of the committee. So,
sorry, Chris, I should have said goodbye to you as well. Thank you very much.
Chair, I'm having difficulty sharing my screen, so if I can just read off it, is that okay?
That's fine. Anna, do we know if we've given Kerry permission to share his screen, or is there any way we can share Kerry's document?
He does have permission. If he wants to send me the latest version, I can try and share it. If
Yeah.
that's what you want.
I think I may have it now, Anne-Marie. Thank you.
Yeah, perfect.
Can colleagues see that?
I can see
Thank
it.
you.
Somebody tell me that everyone else can see it.
Yeah. So if I start then, Chair, if that's okay. So thank you.
Yeah, lovely. Thank you.
We said we'd bring a presentation this evening to update on the impact of COVID on social care across the system within Ealing. So I've got a range of information here, and we'll take questions at the end, Chair, if that's okay. So the current situation, we've currently got 6 care homes closed or partially closed to new admissions in Ealing, as I've raised before. With the committee, that there are strong relationships between the council and providers to close where there are outbreaks and to minimise the impact on residents and staff. There's a further 3 care homes who've enacted self-closures for new admissions. These would sit outside of the parameters that we set locally in terms of closures, and their decisions that are made by the provider themselves. Throughout, I would say at least the last, probably getting on for 10 months, care providers have been reporting good PPE capacity. That's both in domiciliary care and in the care home sector. And the National PPE Portal is offering free PPE for care providers until the end of June 2021. And if there's a further update on extensions to that date, I shall let the committee know. Currently, we have over 12,000 home care hours available. That suggests that the care home sector in Ealing is buoyant and dynamic, and that supports us in terms of the shift away from people wanting to or wishing to move into the care home sector and remain in their own homes. Currently, the levels of staff absence in Ealing for domiciliary care are 6% and 4% for all care home staff. We've had consistently good performance in this relative to the rest of London. At one point in late December, London was reporting between 15 and 20% absences across the staff groups. 84%, and Nehar mentioned this earlier, have received the COVID vaccine, and that was as of the 1st of February. In terms of internal services, these are council services. All absences that are listed below, including annual leave, were as of the 3rd of February. Out of a total staff workforce of 356, 59 were absent, which equates to 17% of the adult social care workforce. In terms of COVID, 36 were absent due to sickness, 10 were confirmed COVID cases, which is 2.8% of the workforce, with 1 suspected COVID case. Staff continue to work at home where viable, with community visits being made where required, and directly provided services which have closed due to the COVID pandemic continue to include the Michael Flanders Day Centre, which is a day centre for older people with dementia type illnesses, and the Cowgate Day Centre for people with learning disabilities. The respite service at short breaks in Green Lanes continues to provide services, but at a reduced level, to ensure that we've got a COVID secure environment, and we are continuing to support people and their families in crisis through offer of respite services through that service. In terms of the external day services, the council continues to work closely with the external day service providers, and between March and October of 2020, the council funded services at pre-COVID levels to support outreach offers. Post October 20, the council worked with providers to reopen services in a COVID secure manner. Unfortunately, in late December, we had to take the decision to ask services to once again close and reinstate outreach services. This decision was driven by the increase in community infections due to the new variant of the COVID virus and the significant impact that we know that COVID can have on people with learning disabilities in terms of their health and well-being. In terms of safeguarding activity through the pandemic, the level of case safeguarding concerns has remained relatively constant during the COVID pandemic. We're expecting to see a slight increase in the number of concerns that are raised. There were 892 safeguarding concerns raised in 1920, and in the first 2 quarters of 2021 there were 453 concerns raised. We've been very concerned about domestic abuse, and it's an area that we've been working very closely on, both with the wider community but also within our staff group. And we think that there's a slight increase in domestic abuse cases which are being reported, but we're continuing to have a strong focus on that area of safeguarding. In terms of provider concerns, this is where there's concerns about quality of services offered from registered providers. On average, at any time, there's approximately 6 provider services at any one time, and this has remained the case throughout the pandemic. The safeguarding team has continued to attend domestic abuse MARACs and working with Standing Together and Good Links with Advance, which provides independent domestic abuse advocacy to support individuals. In 2019, there were 9 referrals to the Safeguarding Adult Review process, and in 2020 there were 18. This is an increase, but we think this is a result of an increased level of awareness within the safeguarding services within the council and our partners, and we're picking up any thematic issues such as work with issues and concerns about people living in sheltered accommodation, which has been led by our principal social worker. The safeguarding team and the finance team are running a campaign to raise awareness of financial abuse, and I'm sure that colleagues have seen increased concerns about financial abuse and fraud during the period of the pandemic. The safeguarding team and the Safer Communities team are also starting to work and develop work around cuckooing, and this has been identified as a cross London issue as vulnerable adults are targeted by gangs and drug dealers accessing their properties. In terms of hospital discharges, the council's been working very closely with NHS partners to ensure that patients are discharged in a safe and timely manner from hospitals. There's been significant pressures on the system, but the current position as of last week, I think this data is that occupancy across London acute sector is running at 91%, Northwest London is running at 90%, and Northwest London University Hospital Trust capacity is running at 96%. We've had some really positive comments from NHS partners with regard to how the council has been working with the NHS to support safe and timely discharges, and throughout the Christmas holiday period we had pretty much a full staff cohort working throughout the bank holidays and the Christmas time, and that put us in a very strong position in terms of supporting NHS partners to support discharges and manage capacity within hospitals for Ealing residents. Thank you, Chair. Shall I stop sharing now?
Yes, thank you, Kerry. Okay, lovely. Right, do we have any questions from colleagues? Sorry, I haven't got my I'm trying to find my thing so I can see if there are questions. If we don't have questions at the moment, what I would... Oh, Councillor Burke. Sorry, I missed you. Go on, Councillor Burke.
Just a couple of quickies. Sorry, Kerry, that was loads of information and very useful. Thank you. Just a couple of quick ones. In terms of the homes that are closed, how are we picking that up? Because I'm assuming it's a diverse, privatised system. So where are they going? And has that got any implications in terms of and what we're doing about having those COVID secure places, bad choice of words, where people from hospital are still haven't tested negative, but need somewhere to go to help with discharges. So is one having an impact on the other, and what are we doing about the discharge safe place for people to go to?
Thank you, Councillor Burke. So we've been working throughout, and I think we had this up and running in early April, late March, where we've had a multidisciplinary care home cell that's included CQC as the regulator, people from my service area, people from the public health sector, representatives from the Argyll Surgery and ECP and other NHS partners, and reps from the provider sector, to ensure that we have a very coherent approach to care home closures. We have very strong parameters in terms of when care homes should be closed in terms of outbreaks, and it's where there's two confirmed or suspected infections in staff or within the resident cohort. The care homes have worked well with us. I think the care homes are very clear it's in their interest to manage outbreaks and manage them effectively. So there are strong arrangements in place in terms of responding to closures. The vast majority, the huge majority of provision in the borough is diverse, as you describe. There's a small number of voluntary sector organisations. We've got huge providers such as Four Seasons and Bupa, and also a range of owner-manager schemes, but we're working consistently with them throughout the piece. And where there are any issues in terms of their infection prevention control procedures within the care home cell, we're very clear that we work together to inform and educate those providers where concerns are raised. In terms of the designated care settings, I think is what you were describing in terms of people stepping down from hospital. The Mary Robinson unit has been stepped up to its full 24 beds and has been at that level, I think, since November time. The NHS has also commissioned an additional 65 beds in Hounslow to support with that pathway, to support people with a positive diagnosis coming out of hospital, so they wouldn't have to move into the care sector. So there's been a significant response. The additional capacity in Hounslow has created a lot more space to ensure that people don't have to return to care homes, but also people with a positive diagnosis can move into those homes if that's thought to be clinically the right move.
Okay, Councillor Burke, did you have another question? Sorry. No? Okay, lovely. Seeing any other notifications from councillors. So what I suggest I do is we go to Roy Willis again, because Roy has some questions on this specific item that he notified us of in advance. Roy, are you ready? Yeah, you're there. When you're ready.
Hello.
Roy.
Hello. Thank you, Chair. Yes, yes, we did submit some questions earlier, but we've left some of them to be answered by written replies after the meeting. So the main question that we've got tonight is about domiciliary care, and really I think it may be partially answered by what Kerry has presented already, but I'll just say it anyway. How many people are now receiving care packages at home in comparison to February 2020? And has the number or size of care packages changed? And as a supplementary to that, is there evidence of people cancelling care or refusing to have care visits at home because of their anxiety about the COVID pandemic? Thank you.
Thank you, Roy. Thank you, Roy. Thank you, Chair. I've got the data from April 20 to December 20, Roy, because that's within the financial year. In April 2020, the council was providing and funding just over 86,000 hours per week of home care. And in December 2020, those hours had increased to 106. In April 2020, there were 490 people, older people supported in care home placements by the borough. And in December 2020, there were 425 individuals. So you can see that the increase in domiciliary care is reflected by a decrease in a use of care home placements. we're not hearing significant numbers of people not wanting to have domiciliary care support in their home. I think the increase in the hours reflects that. There was a period of time at the start of the pandemic when families were so concerned about transmission to their vulnerable relatives and vulnerable individuals were not wanting people to come into their homes. I think we've provided significant confidence in terms of our work with the sector and our brokerage service in terms of how we engage with the sector about being absolutely consistent about our expectations in terms of UPE and PPE and infection prevention control procedures.
Okay, thank you, Kerry. Roy, is there anything you'd like to come back on from that, or are you happy?
Yeah, that seems to confirm what we've been thinking, really, that that people are reluctant to go into residential care. Relatives are reluctant to let their family members go into residential care across the sector, and that there's some fear and about that, and that so people may be staying at home longer, and that's putting more pressure perhaps on families and on unpaid carers, and so that maybe that they're now asking for more support. So it's good that is being provided. So I'd like to that's a trend that we need to keep an eye on, because obviously if less people go into residential care, as it seems to be indicated, the financial viability, sustainability of some residential care homes may be undermined, really.
Yeah. Kerry, sorry, you wanted to come back.
Yeah, thank you. Roy's point's absolutely correct. The LSE is predicting that they think the behavioural change will impact for 3 to 5 years post-COVID in terms of people's willingness to go into institutional care settings where they're able to remain at home. This will put some pressure on the marketplace. We know across London that there are many thousands of vacant beds within the care home sector. We know that the government has provided a lot of money that has been passported via the council to the care home sector to support them with a range of issues. I meet on a regular basis with a group of colleagues from within the council where we look at the risks within the market so that we can try and keep us abreast of the issues and potential risk providers in the borough to ensure that we can put input and support as required to those homes.
Well, thank you. Alan, can I come to you?
Yes, thank you, Chair. It's just a point of interest. We know that there are very high numbers of residents in care homes dying, but do we know what sort of statistics there are in domiciliary care where actually clients are coming into contact with a wider variety of carers? Because in a care home you can actually contain the issue, but in domiciliary care you can't, because you've got the chance of multiple carers coming in. Is there any statistics about this or not?
I've not seen anything on that, Alan. I think it's a valid point. I think, to be honest with you, my view is that it's easier to provide infection prevention control procedures in someone's own home because it's a more contained environment. We've had very clear discussions and directives with domiciliary care providers and residential care providers about the importance of PPE and the infection prevention control protocols. The care home deaths have been tragic. They've not been as a higher level as maybe is being reported elsewhere nationally in Ealing, but we can certainly, I'll go away and look at the domiciliary care death rate to see if there's any comparable data. I think that would be a useful thing to look at.
Okay, I'm going to use the chair's prerogative and ask you a question, Kerry, which is broadly related to what Roy and yourself were discussing previously. If the impact post-COVID is going to be so strong as to change the uptake in various services for 3 to 5 years. And given the number of people within our borough who are going to likely require these type of services in the not too distant future, how flexible is our approach in terms of modelling and funding and preparing for any different behaviour or any different requests from the regular client group or the client group that's about to come into being, if you know what I mean.
Yeah. So the real strength that we have in Ealing is our domiciliary care market is very dynamic. We've got a large number of providers on our contracts. We have a range of over 1,200 hours per week available for commissioning as required. So we've got a dynamic market, a buoyant market, and capacity. So we're relatively confident, and have been throughout the crisis, that the domiciliary care market can respond to the crisis, and also will be there to support us in the future if the behavioural changes continue for the 3 to 5 years that are being reported via the LSE. If there were to be market failures in terms of specific care homes no longer able to be financially viable, we're engaging very closely. There are limited powers that the council has available, and I'm not sure that a council would look to bail out any of these homes, but we would work very closely with those homes to see what options are available. And if they were to close, we would work very closely to ensure that people were moved in the most effective and responsive way to their needs.
Okay, sorry, I was fiddling with my mute button. Thank you very much. I think that's very useful. I just want to go around colleagues one more time to see if they have any questions before we sum up this item. So if you have a question, could you raise your hand if you're able to do that, or could you post in the chat box that you want to ask something, or for at least one meeting, your chance to grill Kerry will be over.
No, thanks, Dan.
Is that no thanks, Andrew, or did you want to have a go?
No, I'm done here, thank you.
Okay, lovely. Yeah, brilliant. Okay, on that basis, I'm going to sum up this section by first of all saying that we have immense gratitude to Kerry and his team, and the social workers and domiciliary care workers and everybody who's going out and continuing to do these very difficult jobs and very important jobs at a time of real distress for a lot of people. Just the human contact for some of these residents is really important. And I'm pleased at least that we're recognising and planning for an impact to these services that outlasts the pandemic, and that we're starting to look at how those services might be shaped in the future, particularly given the amount of spending that the council has to do on social care and will continue to do for some time. So, and I'd like to thank Kerry as well for being so willing to come to this panel and give up his time, so that we can analyse these things, as I'm sure we will do in the future. So on behalf of the panel, thank you very much, Kerry, and please pass on my thanks to you, to your team as well, because your work is greatly appreciated. Thank you. Right, we're almost at the end, colleagues. The final item that I have to put before you is the work programme, and I would draw your attention to the fact that the matter that Eve Turner asked us to raise with the health service is due to be covered in primary care and out of hospital services on the 28th of April. Now, the depth, Eve, into which we, because I think Eve is still with us, the depth, Eve, into which we can go to those items is yet to be determined, and is obviously impacted by COVID itself. But I will certainly pitch to them that there is significant local interest in how these services evolve and what the plan is for them going forward. So it's scheduled. What information I get is not entirely in my gift, but at the very least, you'll have an opportunity to ask a question about it next time, and then we can decide how in depth we want to go for subsequent meetings. So that is the next meeting is on the 28th of April, everybody. Councillor Burke is indicating. Councillor Burke, please, yes.
Just on that, I think one of the things that I think would be really useful, if they can't cover everything because it's such a huge thing, is the access in terms of the top priority groups. You know, things like cancer care, and then the second level of cancer care. So I think that would be really helpful if they can't cover all the elective, etc., etc. It's just the progress on those urgent cases.
Sorry, I'm just writing it down. Lovely. And I've written down the wrong place, so let's put it in the right place. Yeah. Okay. Thank you very much. Any more comments about because this is our last meeting. Oh, sorry, that meeting will be our last meeting of this municipal year. So we'll try and cover as much as we can there, but it may be for a new chair and a new panel to pick up some of these items as well as some of the unallocated items. But as always, I'll be available on email to discuss with you anything that you want to raise in due course, and between now and then, obviously. So look, I'd like to thank you all for your participation. I know it's not easy in these COVID times. I know these aren't like the normal meetings that we have that are normally quite freewheeling and we try and get everybody involved, but we're trying to do our best with this technology, and I hope you feel like you've had the opportunity to ask as many questions and be as involved as possible. And I'd like to thank you all for being here and being involved, and wish you all very well. Stay safe,